After 40 years, there are still many questions surrounding IVF treatment, and that's where Dr. Shane Plosker at the Women's Health Center in Tampa is here to talk about the improvements behind in vitro fertilization. I like being able to say improvements, but first, welcome back.
Thank you. Glad to be back.
We had so much to talk about the last time. We filled the time like no other, just talking about how women 30s, 40s, you tend to see pregnancies out there, but sometimes can be difficult. And I know a lot of times people turn to IVF. Explain what it is and how you are able to help.
So IVF is a process where the woman is given fertility drugs. And the goal of the fertility drugs is to get the ovaries to release as many eggs as we possibly can during that particular month. So in normal circumstances, right, women release one egg at a time, have one baby at a time. The goal here is to get as many as we can. We do ultrasound monitoring and blood testing. And with the ultrasound and the blood testing, we can determine when the eggs are mature. Once they're mature, we retrieve them in a 15 to 20-minute procedure, fertilize them with her partner's sperm, and then at some point in the future, transfer a certain number of fertilized eggs back into the uterus, usually in this day and age, one fertilized egg at a time.
I feel like IVF is something, and it's probably just with my age and being pregnant. I feel like so many people my age, 30s, 40s, have been able to go ahead and move forward with IVF. I didn't realize how popular, how common it is. Are you seeing more people seek out IVF, or are we just becoming more educated about it?
We're without a doubt more people. I mean, if you look at the number of IVF cycles in the United States, annually, it's well over 200,000 now. And I can remember not so long ago, 10, 15 years ago, when it was closer to 100,000 or even less. So it's become a much more accessible treatment.
Okay, accessible, how has it changed? How has it improved? Because of course with the technology, I'm sure you've been able to see improvements in your practice.
Huge improvements. So I've been around since the beginning of IVF actually. So back in the mid 80s, the procedure to get the eggs was a laparoscopy. So it required general anesthesia, required a couple of little abdominal incisions. It was really very uncontrolled. We would follow women and we were at the mercy of when they were going to ovulate. So back then it wasn't beyond the possibility of sitting there at 2 in the morning doing an egg retrieval.
Oh, wow.
So things have improved tremendously. Even in the mid 80s, what started is we were able to do ultrasound guided retrieval, which is a much less invasive procedure for the patient, for the woman.
And correct me if I'm wrong, but a lot of women have to have this multiple times. Some choose to have it multiple times.
And that's true, although that's one of the other improvements is that as things have gotten more sophisticated, it's not beyond the realm now that women will go through one retrieval, get all the eggs they need, and then have those embryos available to build the rest of their family.
Okay.
So they have their baby, and a year or two later, there are some frozen embryos available, and they're able to come back and have another embryo transfer with the frozen embryos. So that's one of the improvements that we've seen.
In our last segment, we discussed age again. When is the time to call? When should a person and their partner say, okay, we've struggled, we went this amount of time, let's pick up the phone?
Okay. So I think a lot of that depends on age. If you're under the age of 35, I think it's reasonable to try for a year on your own before seeing a physician. Between 35 and 40, I probably wouldn't give it much longer than 6 months. And I think once you're 40, it, to my opinion, doesn't hurt to just call and get an evaluation, and you absolutely should continue to try and get pregnant on your own while all this is going on. Doesn't hurt to get a head start on everything. And
in closing, you and I were chatting too. We know so many people who went through IVF for a first baby and then nature had its way on the second. And you say that that is absolutely something that is common.
It's absolutely something that can happen.
Oh, good stuff. Well, I'm so glad you're able to help families, help people have the children they want. And again, like you said, depending on your age, maybe you want to call today. Maybe you want to get more information and see how they can help you. Of course, it's all at Women's Care Florida. Women'sCareFlorida.com is the website. Thank you so much. It was so nice meeting you.
My pleasure.